Hello, I'm Dr. Kumar Narayanan. I'm a cardiologist working at Medicover Hospitals in Hyderabad. Today, I want to get across an important message related to the problem of sudden cardiac arrest in the general population. Every year in India, about 5 lakh people succumb to sudden cardiac arrest and die as a result of it. And sudden cardiac arrest fundamentally is a situation where the heart suddenly stops because of a dangerous electrical disturbance. Often, this can happen in patients who don't even have an idea that they have heart disease. In other words, a sudden cardiac arrest event may be the first manifestation of heart disease in a particular patient. And what happens is that these unfortunate people suddenly collapse out of hospital, as many of you may have seen in certain recent news items as well. When a person suddenly collapses like this and the heart abruptly stops, there are literally minutes in which to save the patient before irreversible brain damage happens. And this is where the role of bystanders who are nearby that situation can be very valuable. Recently, there has been a lot of awareness among the general public about the technique of CPR or cardiopulmonary resuscitation, where you're taught to apply compressions to the chest using both hands to press hard and fast right in the middle of the chest in order to keep the blood circulation going in a patient who has had sudden cardiac arrest. But it is important to know that giving chest compressions is only one component of the emergency response. There is another equally important component upon which there is not much knowledge in the public at present, and that is what I would like to focus on today, and that is basically the use of an AED or an Automated External Defibrillator. So what exactly is an AED? An AED is a machine which basically can be connected to the patient's chest, and it can automatically diagnose the presence of a dangerous rhythm disorder, and it can deliver an emergency shock to the patient's chest in order to convert the rhythm back to normal. This is very important because even if good chest compression is given, the use of an AED to convert the rhythm back to normal is very crucial in order to save a patient's life in a dire emergency like this. Several Western countries have successfully used this kind of AEDs by the public, by bystanders, common people, and this has resulted in much better rates of survival when a person collapses out of hospital. So today I just want to run through a small demonstration of how an AED can be used. With me is an emergency physician, Dr. Azufio Pimu, and also a paramedic, Mr. Seshagiri Rao. The AED has basically two components. One is a box like this, a console, which has the buttons labeled in sequence, which tells you which order to proceed in. And then it has a set of patches which get connected to this device through a plug-like thing. And then these patches need to be applied on the patient's chest. So first thing you do is basically to switch the AED on. Once you switch the AED on with this power button, the voice will come from the AED which will guide you as to what to do next. So I want you to listen carefully as I'm switching the AED on.
Apply pad to patient's bare chest.
It is
Plug in pad connector next to flashing light.
It is asking us to apply the pads and then to plug it in, basically.
Analyzing heart rhythm.
Now it is analyzing the rhythm. You don't
Do
have
not
to
touch the patient.
do not touch the patient.
Shock advised.
It is advising a shock.
Charging.
It is charging by itself.
Stay clear of patient.
It's asking you to stay clear, so move away.
Deliver shock now. Press the orange button now.
So now it is asking you to deliver the shock. You just have to press this button without touching the patient.
Shock delivered.
The shock has been delivered to the
Begin
patient.
CPR.
And then it is asking you to begin CPR, and then you can go ahead and do the CPR. So Essentially, it is a simple 1, 2, 3 step in order to use an AED. So, AEDs need to be available, first of all, in many public places so that one can be readily available in an emergency. So this is basically the same principle as having a fire extinguisher in different places. Government regulations mandate that different places like offices or residential apartments should have fire extinguishers, and they should be regularly maintained in the eventuality of a fire accident. But do you know how many fire accidents, deaths happen in India every year? It's estimated to be around 20 to 25,000 per year. And yet, I'm not reducing the importance of fire accidents in any way. But while we are very diligent and we make sure that we keep fire extinguishers, the same level of seriousness also needs to come in. And it is time that every major office and every residential society purchases and maintains an AED which is accessible 24 hours round the clock. As you have seen, it's not complicated to use. One need not fear to use it. And in the event of an emergency where somebody has collapsed and having a bad heart rhythm, this might just save that person's life. So I hope that after watching this, all of you will get curious about what an AED is, and then if you're living in a society or in a residential complex, you'll make an effort to purchase an AED. It's not very expensive, and also to learn the life-saving technique both of CPR and also the proper use of an AED. Thank you.